Good morning, everyone. My name is Nishma, Dr. Nishma Shah. I'm a GP and in my previous life a pediatrician. And Claire?
Yes, hello, and I'm Clare Gerada. I'm also a GP, and Nishma and I are both GPs at the Hurley group. So you may have heard of some of us, and you may know of some of us. And we're delighted that you've joined us, and we're expecting a few more, but we'll kick off anyway. Delighted that you've joined us, which is to look at preparation for nursery with a focus really on vaccination. But before we start the sort of main what we're mainly going to talk about, there is a Q&A, and you're more than happy to leave any questions at any time. If you don't want to leave your name, that's fine. And we're delighted to ask any questions. Ideally, not specifically about your own baby, but if you want to talk about issues that have had to your child, then please do. The webinar will talk for about 20 to 30 minutes maximum, but we then really like to get some questions from you. So I'm going to ask Nishma really, because some of you, I don't know, most of you, I think, will be looking at your child going to nursery, or some of the children may have started nursery. Nishma, I've just become a grandparent. I've got two grandchildren, both of them under 2. I have never myself been more unwell than when I first started in general practice. Why is this? Is it them that's giving me the infection, or what is it?
It is very, very common in young children, especially under the age of 5, and they will get a minimum of 6 infections a year. When they're attending nursery, preschool, it's actually more and can be up to 12 infections a year. Most of them are harmless infections and what we call self-limiting, in that the body treats them and they get better naturally. Because children mix with each other, for the first 6 months, they're protected by maternal immunity, so mother's immune cells in the child's blood system. But after that, they sort of have a blank, clean slate of immune system. And so their immune system's learning by picking up all these viruses, common colds. They get rashes which are associated with viral infections like roseola that you see commonly. Chickenpox is another one. They get hand, foot, and mouth disease, again common in nursery children, and they get things like bronchiolitis, which is a chest infection, and often this is what we see very commonly in general practice, and also.
So yeah, so we've got some slides, Nishma. I mean, we're not going to go through all of these in great detail, but what you've identified is, I suspect, what many of the parents have already experienced. People often get terrified of when they say they've got hand, foot, and mouth, because they think of it as the cow's disease, which is actually foot and mouth. And this is hand, foot, and mouth. And the giveaway, ladies and gentlemen, is it occurs on the hands, the feet, and the mouth, and that's a giveaway, and it's sort of blistering lesions. And Nishma, it's a common illness, isn't it? And what should parents do if they see this?
This is a very common illness. It looks worse than it is, and the blisters can be a little bit painful, but main thing is just treating with simple pain reliefs like Calpol, paracetamol. But really, it's an illness that just peters out by itself over 7 to 10 days, and it's not really anything to worry about. If they get secondary infections, you can always contact your GP, and they will be more painful, sort of pus around the blisters, but that's very rare.
But on the whole, it's a blistering. It looks like
Yeah.
they actually look like bed bugs, but they're not bed bugs. Nishma, this one also terrifies patients when we use its euphemism. It's sort of slap cheek. It makes you think that we've slapped the cheek of the child, and it's also called fifth disease. What's this one? This is
another. Yeah, this is another viral infection, and it's one where the cheeks look like they've been slapped because they go so red. It's less common than the other ones. We don't see it as much, and this one can have some complications. But in majority of the cases, again, it's a self-limiting infection in that children just get better after a period of time. They will get fevers, etc., and you treat the fevers as you would any fever with paracetamol.
This is the sixth disease, and this again is for parents. And I have to also say, even though I'm a GP, when I saw this on my granddaughter, quite off-putting to see your child covered in a rash. But what's this
So
infection?
this is roseola, or what we would sometimes call a viral rash. It's quite a scary looking rash. It can sometimes make people think their child's got measles because it looks like it. Or, the other fear is the meningitis. But actually, this is a rash that happens at the end of like a common cold, and it's caused by viruses. It kind of signifies the end of the illness, and the rash will last 7 to 10 days, and then just disappear by itself. It affects the whole body, and it's what we would call a blanching rash, which if you press on the red areas, they actually become white when you press on them. And so that's how we test it in practice to check
And
that it's not a dangerous
but
rash.
Nishma, I know a lot of parents have talked about looking for blanching and non-blanching rashes in their child who's got a rash. And I'm always fearful of this because I'm always fearful that the poor parents have got a sick child. They're very worried the child might have meningitis. They're searching for a jam jar or a glass. They drop it on the floor because they're so worried. It's dark. There's not good enough light. And then they're thinking, is this blanching or is it not blanching?
Yeah.
Do you think this is something that, I know it's told for parents, but do you think it's useful for parents to do this?
I think probably the more useful thing is to trust your instinct. So, as parents, you know your children best, and you will know when their behavior has changed. You will know when they become quite listless and not interested in anything. Normally, children don't pretend to be sick, especially the younger ones. They will just behave how their body's sort of telling them to. And if they're feeling unwell, they'll become quiet. They'll not want to eat or drink. They're not really interested in any of it. They'll just want to sleep or be really clingy to parents because they want that comfort. And those are the things you can look out for, which are easy. And if you're worried, then you contact your GP. If you're comfortable doing the test, of course, but this is something that we would do when we see children in practice, just to test everything and measure everything. However, trust your instinct. If you feel a child is really not behaving like them normal selves, you will know best. Contact us and we will arrange to see
And,
them.
and having had 40 years as a GP and seeing, I think, thousands, if not tens of thousands of children, my feeling is if a child looks like I call it the child looks happy, it wants to engage with you. The child might be miserable because they're sick, but their eyes are bright, they want to engage. I become less worried. The other telling issue I've always had is trust the parents. Trust the parents. If the parents are concerned, then I raise my own level of concern. But equally, we're very happy to see a child 5 times in a single day if necessary, especially the under ones, maybe the under twos, but under twos, under ones, under 1 month, we'll see them immediately. So please don't worry. These are rashes that when your child first has one, you think, oh my gosh, what's going on? And the next one, I'm sure all of you will recognize. And Nishma, shall I talk about this one? This is something, chicken pox. And the secret about chicken pox is, and Nishma's looking at the questions, the secret about chickenpox, or the way to know about chickenpox, is, again, it's an infection that lots of children have, and it's much better they have it in childhood than in adulthood. And I know there's a vaccine coming along, which we can talk about, but it's the only rash that comes in stages. All the other rashes, more or less, they're there or they're not there. So you'll wake up in the morning and your child will be covered in that rosella rash. But chickenpox, they might get one on their finger, and then one in their head, and then one on their nose, one on their leg, and they come in crops, usually over 24 to 36 hours. And that is the telltale sign. So when a parent rings us up and says, my child's got a rash, our first question will be, tell us what it looks like. And they say it looks a blistering rash, it looks like a bite. Does it come all at once? Yes, it hasn't come all at once. And then we also looked. So chickenpox rash occurs all over the body. Oddly enough, it doesn't occur on the palms of the hands or the soles of the feet. Nishma, somebody's asked if the children get free chickenpox vaccine yet. What's going on with the chickenpox?
So it's not at the moment. Chickenpox vaccine is not in our national schedule for children because essentially it's mostly a harmless infection, which once they've had it provides good immunity for the rest of their life. There is some consideration of adding it to the regime. babies or children can get it if they are susceptible and have an immune disorder or are about to have a treatment that requires them to be vaccinated prior to starting that treatment. So yes, some can, but only if they're eligible. Otherwise, for just regular children, it's not in the schedule yet.
But the important thing is it's a mild illness in children,
Yeah,
but where it can cause problems, and this webinar isn't about this, is in pregnant women who haven't had the infection, who haven't had
yeah.
chickenpox. So if you've never had chickenpox, or you think you've never had chickenpox, it might be worth, and you're planning to become pregnant, or you are in the early stages of pregnancy, you might want to discuss that with your GP, because in the later stages of pregnancy, it can cause some harm. So the final mild illness, and many of you won't think these are mild, is herpes simplex, and that's the next slide. And some of you might you cut, and so herpes simplex you might think of as a cold sore. It isn't a cold sore. Cold sore is what you get after you've had herpes. It's a secondary herpes, if you like. And the first time the child gets herpes simplex, this isn't these nasty herpes that you might have heard. It's a horrible blistering rash that occurs mainly in the mouth, in the mucous membranes. It can also occur in the vagina. It's very painful for the little thing. And again, we tend to treat with painkillers and lots of reassurance. It doesn't tend, it very quickly goes away, but it can be painful and can cause the child some problems in feeding. We used to, in my early days of general practice, put a cream to go on these little blisters, but they don't really work. What's your sense of it,
No.
Nishma?
So yeah, no, exactly. It's quite painful, and the thing that children tend to do is not want to eat or drink, but they will have things that are cold, like ice cream or yogurt. They can, and also ice around the blisters because there isn't really a medication. You would just allow this to peter out by itself, but giving them soft, cold rather than salty foods is better. And they may take those like cold yogurts
Now,
and ice cream.
Nishma, can we prevent any of these common
It
illnesses?
is very difficult to prevent them. They are circulating viruses that the child need, the what child's immune system picks up. And most infections actually are harmless and building up immunity in the child, preparing them for later life. Um, it's you can, there's things like hand washing because children, when they're in nursery, it's very difficult to control that environment and keep it clinically clean. And that's not what should be done anyway. But when they get home, hand washing is one of the things that can help prevent spread to other members in the family at home. But there's minimal things. The other thing with preventing, not these harmless sort of self-limiting, but the more serious infections is immunizations, of course. And
That
there
takes
are
us to
lots
the
of
next slide.
vaccinations in the schedule that we'll go through.
So that's the next slide. So just to recap on the minor ones or common ones, and we'll move on briefly, is there's not much you can stop, just other than wrapping your child up in cotton wool, but they're going to get them eventually. And many of you, the children don't go to nursery, will notice that when they start school, the age of 4 or 5, that's when they've become ill every 10 minutes. And so sooner or later, they're going to get this. But as Nishma said, we're now on to the more serious illnesses and the vaccine schedule. So we're going to put up the next slide, which is the more serious illnesses. And we don't really, these are the ones that these are the common serious illnesses, or common, used to be common, and the ones that we tend to vaccinate against. And we're not going to go through them all because it would take all day. But many of you, or many parents, are concerned about the number of jabs, Nishma, that their child gets. There's the 6-in-1. So if we go back a slide, Nishma, the 6-in-1 is exactly what it says. It's 6 vaccines in one. If we go to slide 7, that's it. I hope you can see that. So, and then they don't just get the 6-in-1, they get on top of that. Nishma, why do they have to have so many of these vaccines? And what is the 6-in-1? Because again, when I started general practice, we didn't have the 6-in-1. We didn't have many of these. These have been added. So just talk us briefly through the schedule, but why we're putting them all into one go.
Okay, so essentially, the 6-in-1, just very briefly, contains diphtheria, which now we rarely see in the Western world. And it's a very serious throat infection that can lead to blocking the throat and also damaging the heart. Tetanus, which most people will know about, is something that enters through cuts and can cause painful spasms. Whooping cough. Now, whooping cough is relatively common, but in very young children, sort of, in the newborns up to 6 months, it can be life-threatening, which is why a program it was added to the vaccinations. Polio, again, really rare now, but it's quite a serious viral infection that can cause lifelong disability, and that's why it's added. And, the hope is to eradicate it completely. And then Haemophilus is another major causes meningitis, sepsis, really severe throat infections. So that was added. And hepatitis B is really to protect the transfer of hepatitis from mother to child because it's quite common in some parts of the world. So that's the 6-in-1 vaccine.
Nishma, why not give these all separately? Why are they given? So the first vaccine happens between the age of 6 to 8 weeks, and I can remember taking my babies to be vaccinated, and it's the first time you deliberately inflict pain on your child, and it's a
Yes.
horrible feeling. But why are we giving them all in one go? Is that proven to be the correct way?
It's better if you imagine having to vaccinate your baby 6 times rather than one vaccine. It's much kinder to do it in one than to do separate vaccines. Um, because as you said, you're inflicting pain. I mean, it's a short, sharp pain, and very few people will remember being vaccinated at that age or will have any memory of it. So it's actually more effective giving one needle than 3 or 4 needles.
Right. And a lot of these are boosters as the child gets older. Uh, I'm assuming, they've got some immunity after the first batch, and then the other ones are just add-ons.
Exactly. Yeah, they're just reinforcing that immune response to make sure that their immune memory cells are working. So it is really just to make sure that the body has learnt the virus and is able to react to it quickly.
But briefly, some of these are new ones, Nishma. The
Yeah.
rotavirus, for example, has come in recent years. Most parents will know the symptoms of rotavirus, but may not actually know what rotavirus is. Can you just tell us what rotavirus is?
Yeah, so rotavirus is a virus that causes diarrhea and vomiting. And it's, again, one of the sort of more common causes of diarrhea and vomiting in young children, but it can cause quite prolonged diarrhea, which can go on for up to 3 weeks. And actually, it's really quite a miserable illness for the children and a worrying for the parents because they've got this constant diarrhea. And that's why rotavirus was added to prevent that particular prolonged diarrheal illness that children
And,
get.
and meningitis C and B, I know we've
Mhm.
just had a recent outbreak of meningitis. That wasn't C or B, was it?
It was B, but it was a strain of B. Now, there are numerous strains of meningitis B, but it was the one that causes that horrible rash. And it is a horrible condition. And it's also a very serious condition where children who develop it deteriorate very quickly, and hence immunizing against it provides protection from getting this really quite horrid illness, which
And
can
many of the,
cause
the,
lead to
the
death.
people that got meningitis actually were older adults, or
Yeah, it's
because they have
definitely.
been part of this immunization schedule.
Yeah, so they wouldn't have had because meningitis B was brought in probably in the early 2000s, and prior to that, we didn't really vaccinate. So those that were born before that wouldn't have had that protection, and they're at risk of getting it in their
Yeah.
teenage years, university years, which is where it's most common.
And those of you listening to this, the relief as a GP I felt when meningitis C immunization came in, because I think it was a while ago, because our biggest fear, our absolute biggest fear, was missing meningitis, which in the early stages, it's very, I'm not saying easy to miss, but it's very similar to most of the childhood infections, a high temperature, a listless child. And the relief when the vaccine came in, because though, of course, if you're not vaccinated, you still run a risk and have different uh, different infections come. It could still be meningitis, not 100%, but nevertheless, it's largely eliminated meningitis C in small children. Measles, we all know and love, but measles, Nishma, I don't think anybody listening to this, certainly anybody born and brought up in this country, will remember measles. I remember getting measles, and it's a horrible disease. And as a GP, I've seen many patients getting measles, but it's come back, hasn't it?
Yeah, and the measles is horrendous and it's incredibly infective. If you think about COVID, it's probably 16 times more infective, so it spreads like wildfire. And we don't see much measles, or we hadn't seen much measles in this country, but because of falling immunization, we're losing that herd immunity where the protection comes from majority of the people being vaccinated. And so we're seeing outbreaks of measles in communities. I mean, recently it was in the news where there was an outbreak in North London of measles, and it's horrid condition that you still see in some parts of the world, but generally in Western world, we shouldn't really be seeing it. But because of falling vaccination rates, we're seeing
We're
crops
going to come
and
up, we're going to
outbreaks of
come
it.
up, we're going to come and talk, and I'll just add which one I've missed off here. I can't understand why. German measles, rubella, and all of you listening to this, all the mothers listening to this, I hope, have had vaccination for rubella, because it is one of the most catastrophic illnesses that can be transmitted to the unborn child. In terms of its later disabilities, it can cause blindness, deafness, all sorts of neurological problems, and it's done as a schedule of immunization at this age, at baby children's age, and also much later on. But people forget that even rubella in a child can cause serious harm, and can cause deafness, and can cause everything. And I think we've become slightly complacent, a bit like whooping cough. Again, when I started in general practice, we didn't have a vaccine. It's called a 90-day cough, because you cough for 90 days and you lose weight because you're just coughing as a hoop. It's called whooping cough because you hoop at the end of the cough. But it's a horrible illness in small children, and it can lead to infertility in both men and women later on in life. And all of these infections, if you get them at a later life, they're much worse than if you get them at a younger life. So unless there's any more on these, Nishma, you mentioned RSV, didn't you?
Yeah.
I forgot
RSV
the
is
Mothers,
another,
way. I
yeah,
forgot
so
the American one.
just very briefly, it's another recent addition. And this is because bronchiolitis, it's a viral infection affecting the lungs of under twos, and very common, but it just can be horrendous. And lots of children end up being hospitalized because of it, just for needing oxygen. There's no real treatment available for it, but they may need oxygen or they may need feeding, and that's why it was added. And also it then transmits to the older people in the household, especially the grandparents, who then can get really quite sick with RSV, again with lung infections. And so
Yes.
the
And this
idea of
is the one, Nishma, you can almost feel the child has, because you
yes,
feel its chest,
it
and you can
rattles.
actually feel the chest rattle. You can
Yeah.
feel the horrible mucus inside the chest. And it's one that, there's very little antibiotics work for none of these infections unless you get secondary infection, but the child is very sick, and that anybody over the age of 70 at home, or somebody who's got chronic disease, is likely to. Nisha, we're going to move on now for the last 5 minutes into, if all of these are so life-saving, why is it then, and be interesting if people want to ask questions at this stage. Somebody has asked about reminders for all these vaccines from the GP. Yes, you do get reminders,
Yes.
don't we?
Yeah, we do. So we will send out reminders where they get reminders when their 8-week vaccine is due, and then book again for the 12 weeks and the 16 weeks. And then preschool, again, we run searches on all our patients to make sure that they're being called to come in and have their vaccines done.
So it'd be interesting if people do put some comments, because we've seen the lowest level of vaccination now, certainly than I can remember. There was a big dip in vaccination levels when a gastroenterologist called Andrew Wakefield first mooted that measles vaccine caused autism. We now know that's been completely discredited, unbelievably discredited. You might as well say that autism is caused by green cheese. It's just so discredited. And the levels fell then, and the levels are now falling, and they're falling, Nishma, in areas that are the poorest areas, which means it's a double whammy because you've got people there that have elderly relatives who may not be in the best of health. You've got all the secondary issues that might come on if you're not particularly well fed. And you've also got children who are unvaccinated. Why do you think, Nishma, your experience as a paediatrician and a GP, that levels are so low at the moment? And you work in Tower Hamlets, so, and I
Yeah,
work
well,
in Kensington.
interestingly, we used to achieve herd immunity and get 95% rates probably about 5 to 7 years ago, and the rates have now dropped dramatically. So we've lost that herd immunity. And I think um, there's a lot of fear, there's a lot of misinformation out there, and it's very difficult to control the information on social media and know that it's actually real scientific peer-reviewed information. But there's just a lot of misinformation. And we're happy to discuss, if people are scared and have lots of questions about it, we're more than happy to sit and discuss those but I think it is that fear and
There's
misinformation that's
also
really
something
causing
that
that.
was going around that the vaccine had pork in it. Now, actually, the vaccines that are used in the UK have not even a molecule of pork. There is no pork. In fact, there is absolutely no pork in it at all. So that's one thing. And there are some questions coming up, and we'll try and deal with these now then, because I think during COVID, people began to understand the power of vaccines, but there was also a great fear about vaccines, and they are the safest medicines ever. They are the safest medicines of all the medicines any of you take, even your multivitamins. These are the safest. The ones that have got most research. So somebody says, my children are vaccinated. Are these vaccines effective when they be sharing school spaces, etc., with non-vaccinated children? And this depends, JF. Recently, I wanted to take my small granddaughter to the swimming pool, to the local swimming pool, and I asked just what's the criteria, because I didn't know what it was like. Did I need a special time? And the only thing they said to me, well, the child had to be vaccinated, or at least up to where it's age. And I thought, strange, because would I then take in the red book? And I came away and I thought about this, and I thought, okay, it might be difficult for them to prove, but nevertheless, this swimming pool, which is a local authority swimming pool, is taking it very seriously. Changing rooms tend to be crowded. Children aren't that clean, really. I mean, we try best. And so the answer to that depends. If we're running a herd immunity of 75%, yes, your child is at risk, because the whole point about herd immunity is if there's a lot of it around, then it spreads into the community, and even those that have had partial vaccination are still at risk. Is that not the case, Nishma?
Yeah, so I guess partial vaccination helps that when there are a small number of children who are not vaccinated, actually there is protection with that level of vaccination. Um, you can get some protection with vaccines around carriage, and if you are exposed, the illness
Carriage, can you
you
explain that?
develop is so carriage meaning carrying it on your skin but not causing an
Right.
infection. Um, but if you do happen to pick up the virus, the reaction to the virus will be dampened compared to not being vaccinated at all. Um,
So you'll get a milder version, a bit like
exactly,
COVID. If you are
exactly that.
vaccinated, you get a milder. You can, of course, get some of these illnesses twice. You can get we'll talk about what people think, because whether there are some countries, particular. By the way, do we
Yeah,
get reminders? Yes, you will get a reminder. We said, my son is 3 and 3 months and is due for school. No, that you will be
yeah.
contacted for your MMR.
And they'll have had the
It's
first
not,
dose of MMR already. So this is
and
the
it's not
booster.
critical. It doesn't have to be exactly this second, because sometimes this time in the schedule, because sometimes your child is ill, or you might be going on holiday, and you might want the vaccine slightly earlier. Or even slightly later. It's in that window. But it's the fact that your child is immunized gives them a lot of protection, but not complete protection unless everybody has been immunized. And there is some thought, and I was saying there are some countries, in particular America, but not maybe now, where you couldn't go to a state school unless you were vaccinated. And there are some countries, and personally, I would not feel happy about my grandchildren going to a nursery or to a school where the herd immunity was dropping to 65, 70%. I think it's unfair on the children that are vaccinated to be put at risk in any shape or form, and not just them, but their little siblings at home who might just be newborn, their mother who might have just come, new immigrant, not yet had her rubella vaccination, and becomes pregnant without knowing. I think I personally think I'd be concerned about children mixing with other children where there wasn't herd immunity.
I'm gonna go to the next question, Claire.
Yes.
My little one is about to take the 3 years and 4 months vaccination. For her earlier vaccination, she had fever after every single one. Should we expect it to be the same again, or given she's been at nursery for almost 2 years with stronger immunization, the side effects could be weaker? I think you should expect to get a fever because this is really the vaccination is giving the body a little bit of the virus, which is slightly altered, to then form a reaction. And one of those reactions is likely to be fever. And that's just an immune response that the vaccination is supposed to
Yes.
create. And so
They're
expect
not
fever,
having
but no more
the
than.
virus isn't going in the body. It's what's called an attenuated bit of a virus. It's not actually the virus itself
No.
that's going into the body.
Yeah, it's an altered version to give the immune system something to react to. So yeah, the fever should last no more than 24 to 48 hours afterwards, and you can give them paracetamol. It might be milder, some don't get it, but some do, so I would expect it.
So I'll get the next. How the parents can differentiate eczema and any other childhood body rash is a very good question, and it depends really. If you know your child has eczema, then you'll recognise it. And eczema in small children doesn't tend to go to the places that it does in older children, or adults. So in older children or adults, it tends to go what's called the flexures, so the crook of the arm or behind the knees. Whereas in younger children, eczema tends to go anywhere really, other than the soles of the feet or the palms of the hand. Very few infections, or the mouth. One way we GPs differentiate eczema is quite classical. It's scaly. When you touch it, you feel it's slightly rough. It's also it's not a rash that looks like any other rash that we see with infections. You can get both at the same time, which slightly confuses it. If it's very severe eczema, of course, that might muddy the water a bit, and we might think, is this an infective process? But with childhood mild eczema, it's something that as a GP you would recognize immediately. Is that your sense?
Yes, exactly. I think eczema tends to be itchy. A lot of these other rashes tend not to be that itchy. They will only itch as the skin dries when they're healing. But they're not like eczema where there's sort of patchy areas of severe itching.
Yeah, other than
And as
chicken
Claire
pox.
said, it looks very different.
It looks very different. The older the child, the more typical it is because
Yeah.
you tend to get it in the fleshes. By the way, if a child gets eczema under 2, it doesn't mean they're going to get lifelong eczema.
No,
And also importantly, it doesn't mean they're allergic to anything. And I
no.
know we're not really talking about allergies here, but I'm struck by the number of signs that nurseries that say no peanuts, no nuts, even one said no blueberries, no blackberries. The evidence now says that the rise in allergies, or the rise in so-called peanut allergy, is because parents have not been giving their children peanuts at all. And the evidence, of fabulous paper published about 3 years ago, beautiful paper, that showed if you introduce peanuts through peanut butter or whatever at a very young age, when you're weaning the chances of them getting a peanut allergy are practically zero. And so the schools or the nurseries that are excluding this are actually causing more harm than good. But that's for somebody else to
Yeah, just to add, if you don't know the difference, you can also just contact your GP and um, ask them if what kind of a rash it is if you're unsure.
Yeah. So somebody's asked Nishma, they're moving house. So is there a good time of the year not to get infected? Listen, if we
Um,
knew, we'd be multimillionaires. So Nishma, it's more
No, well,
common
I
in
would say
autumn, but
usually the winter months they get more viral infections, and I think the summer months it tends to be a little bit less. I mean, there's no best time, but summer they tend to it tends to be better.